hot, or some parents say that their palms and soles are getting hot, or forehead is getting hot, but the other part of the body is same, normal temperature. So if something like that, I recommend always keep a thermometer at your home and check temperature with thermometer. If temperature shows 100 in thermometer, then only it's called fever. Anything below 100 is not fever. So don't panic unnecessarily. If your thermometer shows the temperature is 100, you can give paracetamol to your child. Paracetamol generally you should give every 6 hourly to your child. The dose of the paracetamol depends on your baby's weight. So consult to your pediatrician to know the exact dose of paracetamol, because if you give the lower dose or whatever dose your pediatrician has prescribed 1 year back, obviously that dose will not work for your kid, because your kid obviously has gained some more weight in last 1 year or 6 months since you last visited your doctor. So always check with your pediatrician what is the right dose for the current weight of your baby. Because if you give low dose, then paracetamol will not work, and then you unnecessarily will become tense, like paracetamol is not working for my baby. So give the correct dose of paracetamol every 6 hourly. And at the same time, if continuous fever or high fever means more than 1 or 2. If fever goes more than 1 or 2, then you should give some sponging to your baby with lukewarm water. Sponge the whole body, not only the forehead. You take some lukewarm water and sponge the whole body. You can give some head bath also if very high fever, like 1 or 3, something like that. So after that, you wait for 4 hours. If temperature comes down to normal, then you give the paracetamol after 6 hours. In case if there is continuous fever or high fever, then you can give paracetamol at 4 hours interval. So here another thing, the parents ask, what is called the high fever? To some parent they might think 100 or 101 itself is high fever, but no. If the temperature is 102 Fahrenheit, then only we consider it as high fever. If temperature is below 102, then you can continue paracetamol every 6 hourly itself. So don't unnecessarily give extra dose of paracetamol, or don't panic unnecessarily. At the same time, many parents they have at their home a different kind of medicines or syrup. For example, ibugesic P, which contains ibuprofen and paracetamol, or meftal P, which contains mefenamic acid or paracetamol. I am telling what are the most commonly used brands in India. There may be other brands available with same composition containing ibuprofen or mefenamic acid along with paracetamol. So many parents ask, like if 1 dose or 2 doses of paracetamol, if fever doesn't come down, sometimes they start using all those things on their own, or they ask us whether they should use all these things, ibuprofen or mefenamic acid. My answer is no. This ibuprofen, mefenamic acid, this has lots of side effects also. For example, ibuprofen can affect kidney of some children. So why unnecessarily you should take all this risk? Paracetamol alone is more than enough for fever. At any point of time, if your pediatrician thinks that ibuprofen or mefenamic acid will be required, then he or she will tell you specifically. Don't use all these things on your own. And also mefenamic acid, they decreases the seizure threshold for our baby. So what is that? We know that sometimes small children, they get seizure or fit with very high fever. So those children who has this tendency of getting fits or seizure with fever, in those children, if you use mefenamic acid for high fever, the chance of getting seizure or fits with fever increases. So unnecessarily don't take all this risk by using this ibuprofen or mefenamic acid without consulting your pediatrician. As I told earlier, if fever occurs for COVID or for seasonal flu or for any other viral infection, it generally gives trouble to your baby for 3 to 4 days, and after that it subsides. So for 3 to 4 days, if fever comes 1 or 2 times per day, there is nothing to panic. That will not cause any harm to your baby. So stick to paracetamol, and if required, give 4 hourly dosing and give tepid sponging to your baby. These are enough. After that also, if very high and continuous fever, then consult your pediatrician. Obviously, there might be some other reason for the fever, and then your pediatrician will evaluate, and then he or she will add extra medicine as required. Other thing is that in fever, it is very important to keep your child well hydrated. Sometimes many parents ask us like what food should we give during while our children are sick. So I would like to tell you that during fever or any illness, the appetite will be low. So don't force your child for taking solid food. Yes, you can definitely offer, but don't force. But it is very important to keep your child well hydrated, particularly during fever, because dehydration can also increase the temperature of your child. So keep your child well hydrated. They should pass at least 4 to 6 times good quantity urine in a day. This is must for smaller kid who are on breastfeeding. So increase, give them more and more breastfeeding. You can give more frequent breastfeeding because they may be cranky, or at a time they might not take a longer feed. So you should give more frequent breastfeeding. Anyhow, you keep your child well hydrated. That is very important. Even keeping a child good hydrated, this is even more important than the medicine itself. If your child is not well hydrated, then no medicine will work, and at the same time, your child will become cranky, more dull. It will give more trouble to your child and also to parents. So, keep your child well hydrated. Now, the next question is, what fluid can we give? Many times, the children, they don't want to take plain water. So, obviously, you can give plain water. At the same time, you can give coconut water, you can give ORS, you can give dal water, sabudana water, ganji water, any homemade soup, veg or non-veg. Try to make it non-spicy, and you can give rasam. You can give. In different parts of our India, different culture, food habit is there. So any homemade liquid which has salt in it and little bit of sugar in it, you can use. Don't give totally sugary liquids. For example, don't give glucon D. Yes, if your child is very fond of it, yeah, one time in a day, 1 cup or half glass, definitely you can give. But don't give too much sugary liquids, because this will not help in your baby to be active. Excess sugar is not never advised. So at the same time, don't give excess fruit juice. Yeah, if your child is particularly fond of any fruit juice, definitely you can give once in a day, half glass or 1 cup. But it's some parents, what they do, not knowingly, if we tell that give more and more liquids, they just rely on fruit juice. Don't do that. Try to choose a fluid which has some salt content in it. So you can definitely give ORS. In ORS also, try to choose a ORS whose composition match with WHO recommendation. Every ORS packet has its composition written on it, and also WHO composition is very easily available in internet. So whenever you will go for an ORS, just check it whether the composition matches with the what WHO recommends. Because in market many ORS is available with flavored, some apple flavored or some other flavored. In most of the cases, their composition is different, and if you give too much of those ORS, then it might cause salt imbalance in the body. So like it might cause some more trouble to your baby. They might become cranky for salt imbalance, so you should not give this. So keeping the child well hydrated means choosing the right fluid also. So these are very small points. Sometimes this is not possible also to detail to tell all these things in this details in our busy OP. But please remember this. This is very important. This small thing makes a lot of difference in our kids' health. So you can give lime juice also, so any liquids. The next point is many parents they start antibiotic on their own. They start azithromycin or amoxicillin or augmentin on their own. They think that if fever comes even after paracetamol, then 1 or 2 doses of antibiotic will help. But this is very wrong concept. In COVID, there is no role of antibiotic, particularly in children. In viral fever or seasonal flu also, there is absolutely no role of antibiotic. So whenever your baby is getting fever, never start antibiotic after 1 or 2 days. First, if you think that antibiotic is necessary, talk to your pediatrician. If your pediatrician thinks these particular fever is caused by any bacteria, then only antibiotic will work. But whatever fever we are seeing nowadays, fever, cough and cold, or sometimes vomiting or loose stool, 99% of this are due to seasonal flu or COVID. In both of these cases, antibiotic has no role. So if you unnecessarily use antibiotic, it will not help, and it might cause side effects, and it might cause antibiotic resistance in your baby. So in future, if your baby gets sick really for some bacteria, when antibiotic is really necessary, then if your doctor starts antibiotic, then your baby's body will not respond. So don't start antibiotic, azithromycin, amoxicillin. In our India, many antibiotic for children are available over the counter. So don't go to pharmacy and don't start any antibiotic on your own. Or if your pediatrician has recommended some antibiotic, when your child became sick last time, don't use the same antibiotic now, because might be this that was a different infection and this is the different infection. So that time your baby obviously might require that antibiotic. That's why your doctor has prescribed this. But that doesn't mean that this time also your baby requires that antibiotic. So try to avoid antibiotic as much as possible. Some antibiotic causes loose stool also. So as I was telling, antibiotic has side effect. Don't unnecessarily use antibiotic. Stick to paracetamol. That is the best and safest medicine for children for fever. If you give paracetamol and your baby's temperature decreases by 2 degree, that means paracetamol is working. So for example, suppose your baby has 1 or 2 degree Fahrenheit fever, and you have given one correct dose of paracetamol according to his body weight. So if paracetamol decreases the temperature by 2 degrees, so from 1 or 2 to 100 degree Fahrenheit, that means your baby is responding to that medicine. So the medicine is working. So don't expect that giving 1 dose of paracetamol, the temperature will totally become normal, 98.4 or 5 like that. Yeah, if it comes from 1 or 2 to 100 degree Fahrenheit, that means it's working. So this is fine enough. After 4 hours, again check the temperature. If the temperature is higher than the normal, then you repeat a paracetamol dose. If the temperature is normal, then you wait, and when after 6 hours, you give another dose of paracetamol. So I think for fever, whatever small points which are small but very important, I have discussed all these things. Stick to paracetamol, keep your child well hydrated. If required, do sponging with lukewarm water. Generally, 6 hour dosing for 3 to 4 days is enough. If high fever or continuous fever, 4th hourly dosing. In short, this is the management of fever. 99% children recover with this management only. Next, we will discuss the second most common symptoms, the cough and cold. So yes, the cough and cold in smaller kid, they really gives trouble. They become stuffy nose and they don't eat, don't drink. So yes, yeah, this is something to be of concern. Again, don't panic. Cough, cold. If your child is having cough and cold, that doesn't mean that that has affect the lungs and your child is developing pneumonia or COVID symptoms or COVID complication. No, that is not true. In third wave, we have seen that most of the cough, cold or COVID symptoms is cough, cold that is present in the upper respiratory tract, that is from nose, behind the mouth, behind the nose and up to the trachea here. It is not affecting the lungs. So whenever we are checking the lungs with our stethoscope, in most of the cases we see the lungs is clear. There is some secretions which is behind the nose in the nasopharynx, and sometimes it affects the oropharynx, the throat. So again, no need to panic. In here also, if it doesn't affect the lungs, then also in most of the cases, 80 to 90% cases, again, no antibiotic is necessary. With home remedies, some home remedies and simple symptomatic syrup, they recover. So what can we do? Let's start discussing with nose block. That is the parents becomes really tense when the child has nose block and they take mouth breathing and they don't eat properly. Yes, the smaller kid, if they have nose block, they can't take breastfeeding also. So for that, use nasal saline drop. You can use nasal saline drop every second hourly also. Nasal saline drop has no extra side effects. So how much you should use, that depends on baby's symptom. If the nose block is mild, you can use nasal saline drop 2 to 3 times per day or 4 to 5 times per day. That is enough. If your child is having severe nose block, then you can use the nasal saline drop every second hourly also. It has no side effect. Okay, 1 drop at each nostril you can definitely use. With that, nasal saline drop works really good in children. So most of the children recovers with that. If after nasal saline drop also your nose block of your child is persistent, then there is some nasal drop which contains xylometazoline in it. Various brands are available, for example, Otrivin pediatric drop or Nasovian pediatric drop. So you can use that. Be particular that you choose the pediatric form of that drop. Don't choose the adult form of that drop. If you're giving the xylometazoline nasal drop, then give maximum 3 times per day, not more than 3 times per day. So this also with normal saline nasal drop and this xylometazoline pediatric form of nasal drop, 99% nose block generally they recovers. Sorry. After that, if your child is for little bigger child, for example, 6 years, 7 years, if your child is comfortable with steam inhalation, you definitely can give steam inhalation. But be extra cautious when giving steam inhalation. Give from a distance, because we have seen some cases of steam inhalation which turned out to be a burn injury. So be extra cautious. And if your child is comfortable to take steam, then only give steam. If the child is crying and very irritable and getting scared, don't force him to take steam inhalation. That will not cause any comfort. That will increase the trouble and suffering for your baby. So if, for bigger kids, if they're comfortable, you can give steam inhalation from a distance. If you have any decongestant or antihistaminic syrup at your home, yes, if nose block is there, you definitely can use that, or talk to your doctor, talk to your pediatrician. Any decongestant antihistaminic syrup you can use if there is nose block. Again, for cough also, if it is dry cough, you can use any antihistaminic syrup. If it is wet cough, there is some expectorant syrup is available in market which contains Ambrodil and Ambroxol and Levosalbutamol. Yes, if you have any kind of those kind of syrup at your home, you can use. And also you can talk to your pediatrician and you can use that. You can use some home remedies. For example, some people they use honey, some people they use tulsi or ginger, tulsi, ginger, soaked lukewarm water. Yes, you can try all this home remedies, simple home remedies. Don't try some Ayurvedic remedies on your own, which is not used in day to day. Yes, definitely. Some people they use honey, tulsi, ginger, black pepper for cough and cold. Definitely, you could use this, but don't try any not known or lesser known roots or something Ayurvedic, because Ayurvedic medicine, if you don't know what is the proper composition, or if it is lesser known in our day-to-day life, it might affect your children's liver, and that might cause jaundice. So don't take all this risk. But yeah, simple home remedies, as I told, tulsi, ginger, honey, black pepper, yeah, or definitely you can use all those things for cough cold. If it might give some symptomatic relief to your child, that is good. Other thing is that don't use nebulization for smaller kid at home. For a nose block, as I was telling, as long as your kid is active and at least drinking liquids properly, nebulization is not required. If your child has some breathing difficulty, not he is not able to take proper breathing, or if she or he is having fast breathing, then only, or some wheezing sound is coming. Nose block sound is different. You can understand the nose is blocked and snoring kind of sound is coming. For that, as I told, there is a normal saline or xylometazoline nasal drop or steam inhalation. This is enough. In case if the sound is coming from the chest, or your child is having breathing difficulty, then only nebulization is recommended. And in that case, it is recommended to at least take the first nebulization under doctor supervision and at doctor's clinic or in hospital. If your child is having mild nose block, or some cough, or some snoring sound is coming due to nose block, don't give random nebulization at home. I have seen many parents, they use Levolin, Duolin, Budec or nebulization at home for simple nose block. No, again, these are not required. And if you use unnecessary medicine in small children, that will cause side effects. So never use those things. Okay, so nebulization, don't use nebulization on your own. And again, the same thing, if the last time also your doctor has advised nebulization for your kid, that doesn't mean that this time also your child needs nebulization. So don't use nebulization on your own risk. And I will tell, a less than 2 years of kid, it is better never use nebulization at home, because sometimes nebulization paradoxically increases breathing difficulty. So don't take all this risk. Other thing is that for cough and cold also, this keeping a well hydration, keeping a good hydration is very much important. During cough, cold, appetite will be low, and if you keep your child well hydrated, then whatever that secretion is, that secretion will be liquidified. It will not be that thick, it will become thin if the hydration status of the child is good, and it will come out. Some parents they tell that see, for bigger kid or adults, they can spit. If we use some expectorant syrup, they can spit that sputum outside the body, but the child is not able to do. So how can does that help? So see, if your child is not it is not required to always to spit the sputum outside your body. There are two pipe in our here in our throat. There are two pipes. One is that air pipe, and in front of that there is food pipe. So if they cough and their hydration status is good, and you are in addition you are using some good expectorant cough syrup, so the whatever the bulgum, the sardi, or the congested liquid, whatever is there, that will come out from the air pipe. And even if they swallow it, it is not going back to the same air pipe, it is going into the food pipe, and then it will pass through stool. So don't think that if my kid is not able to spit that sputum outside the body, that means the sputum is remaining inside her body or inside his body and he is not improving. It is coming, if they cough, if it is, it will come out from the air pipe, and if they swallow, it will not go back to the air pipe, it will go to the food pipe. In that case, it will pass through the stool. So use a good expectorant syrup and keep your child well hydrated. At the same time, I would like to tell, if you're not give enough fluid to your kid, then no cough cold medicine will work. The sputum to come out from the air pipe, it has to be thin, it has to be liquidified. So if you are not giving enough fluid to your kid, no medicine will work. Other thing is that if your child is getting cough and cold, whether it is COVID or whether it is due to seasonal flu, it will take minimum 3 to 5 days to recover. So be patient for 3 to 4 days. And it is a normal finding that whatever cough, cold, it generally increases during night time, because night time the weather also becomes more cooler. Also in our body is adjusted in such a way that the secretion, all these things increases during night, or any allergy tendency there, that increases towards night. So it is expected that if your child is having cough or cold, the symptoms will be little more during night time, during evening time, or during early morning time. So don't panic. Don't think that medicine is not working. No, again, not the same thing. Yeah, night time before going to bed, you can give one steam inhalation. Smaller kid, even if they do the snoring sound due to nose blood at during sleep, you can frequently use nasal saline drops. Like that, and then he will be fine. Keep your child well hydrated. Within 3 to 5 days, they will be fine. If the cough is not improving even after 4 to 5 days of simple treatment, simple symptomatic cough syrup and home remedies, then you need to consult your doctor, and your doctor has to check your kid with stethoscope if required. We need to do chest x-ray and evaluate, and then we will take the further step. So this is for cough and cold. I think I have covered all the points for cough and cold. Next, we will discuss that some child will present with body pain and headache, especially the bigger kid. They sometimes complain of body pain and headache. Again, this is common finding with fever. If your child is having fever, it is expected that your child will have some headache, some body pain. Bigger kids can express this. Smaller kid, definitely they can't express. So, and also body pain, that might be a symptoms of COVID as well. So again, paracetamol alone is enough to take care of this body pain and headache, and good hydration. These are enough. Nothing more is required for body pain or headache which is associated with fever, cough, or cold. Again, don't unnecessarily use ibuprofen or any other painkiller. These are enough. Some children, they might present in COVID, we have seen that some children, they might present with GI symptoms, that is either vomiting or loose stool. So for vomiting, again, you can use some symptomatic syrup. For children less than 1 year of age, generally we use Domstal or Domperidone, and for bigger kid above 1 year of age, we use Ondansetron. It is available in various common brands like Zoffer or Onden syrup or drop. Yes, you can again consult your pediatrician for the correct dose of on-dem syrup, and you can use that. You can use 3 times daily, and after giving the vomiting syrup, on-dem syrup, don't give food or any liquid immediately. Wait for 30 minutes and then only you give. Because if you give the medicine to work for some time, and then you give, otherwise if after immediately after giving a vomiting syrup, if you offer some food, obviously the medicine didn't get the enough time to work, so nausea will be persistent and your baby will vomit, and then the medicine will also come out, so it will be a puzzled situation. You will think the medicine is not working, but actually you didn't give enough time for the medicine to work. So for vomiting syrup, give the vomiting syrup, wait for half an hour, and then only you give some fluid or some food to your baby. Again, during vomiting or any GI symptoms like loose stool, it is very important to keep your child well hydrated. ORS is best for any GI symptom. If your child is not taking ORS, then yeah, you can, as I told earlier, you can use other fluids which has some salt content in it. For example, coconut water, dal water, sabudana water, any homemade soup, buttermilk, etc. If you use ORS, which is the best for particularly GI symptoms, please follow instruction written on the ORS packet while preparing ORS. Like I have seen some parents, what they do, they take 1 spoon of ORS powder and they mix with 1 cup or 1 glass and they give it. So never do that. It is in smaller ORS packet. It is clearly written on the packet that you should mix it with 200 ml water, or bigger ORS packet you should mix it 1 liter of water. So mix with 1 liter of water or 200 ml of water depending on big or small packet, and use it. Give as much as possible to your baby every half an hourly by spoon or by half cup, and then you should finish it within 24 hours. If there is something is remaining beyond 24 hours, discard it and prepare a new ORS solution. Also, while preparing ORS solution, it is very important to to select the water properly. If you use mineral water, then fine. Otherwise, you should boil the water and then you bring back the temperature to room temperature, normal temperature, and then you mix ORS within it. That is the for ORS. And also for loose stool, again ORS is the most important thing. In addition, you can use other liquids also. If you have any probiotic at your home, you can use that. If you don't have any probiotic, you can give curd, yogurt more. That will help in GI symptoms. In GI symptoms, generally, we also prescribe zinc supplementation. So zinc supplementation, uh, you should use for continuously 2 weeks, that is 14 days. Even if the obviously it is expected that within a few days, again within 3 to 4 days, this vomiting and the loose stool, all the symptoms will be subsided and your child will be perfectly normal. But again, don't stop zinc supplementation. If your child gets a episode of vomiting or loose stool, whatever may be the reason, it might be due to outside food intake, it might be due to COVID, it might be due to other seasonal flu or viral infection. Once you start zinc, please give for continuously 14 days. It decreases the present episodes severeness also, and also it prevents the future episodes of vomiting and loose stool. So give zinc supplementation continuously for 14 days. Don't stop. Once your child improves, don't stop in between. And that will not help. Give continuously for 14 days. So these are the things. Probiotic helps very good again for loose stool, and as long as you are keeping your child is well hydrated, then no antibiotic is necessary. Monitor urine output. Your child should pass 4 to 6 times good quantity urine in 24 hours. As long as your child is active and passing urine well and at least accepting liquids well, there is no need to use any antibiotic. In loose stool or vomiting, when you should use antibiotic or when you should visit your doctor. If you see any red color in the stool, that is, if you suspect blood is coming through the stool, then you should visit your doctor immediately, and then antibiotic is necessary. Otherwise, antibiotic is generally not necessary. So this is for loose stools and vomiting. GI symptoms, generally they make the child more weak, and that time keeping a good hydration is enough. Other things are, as I have discussed all these things. Next, I would like to tell how to prevent all these things. That is most important. Prevention is always better than cure. So, as I told earlier, uh, for COVID, using mask, avoiding social gathering is most important. Whether there is vaccines available for children or available for adults, teenagers, whether that vaccine is working against this COVID variant, Omicron, or in future there might come other variant also. The mask is the most important thing. So obviously for bigger kid, at least for more than 7 to 8 years, you can train them to use proper mask and good quality of mask. They can use N95 mask, they can use FFP2 mask, or if sometimes they use clothes mask, they can use double cloth mask. Okay, and train them. Like, see, COVID is not going to leave us very soon, so it is going to be with us in some form, in mild form or some form, for another a few years. So train your, if your child is bigger, then train your kid how to use proper mask, how to cover their nose and mouth with the mask, and it should be snugly fitted. If you use a mask but the air is passing well above the mask or below the mask, then there is no use of mask. So avoid, try, not for very small kid, they might be uncomfortable, but for bigger kid, at least from 7 to 8 years, you can train them. Whenever they are going outside, they should use a good quality mask or double layered mask, double mask, and snugly fitted. It should cover properly their nose and mouth. So mask is the most important thing, and avoid unnecessary social gathering. Yeah, there are some opinion that our children are at home for last 2 years, and how long should we avoid social gathering? So at least try to avoid unnecessary social gathering. If not possible to totally avoid the um, avoid going outside, maybe it is not recommended also, but at least try to avoid unnecessary social gathering, and maintain social distance. Don't unnecessarily go into crowd. And obviously hand washing. See, by this time all of you know from newspapers and from media, there is nothing new for me to tell. Use a hand sanitizer properly, use a good quality hand sanitizer, use 20 seconds, and hand rubbing, and use soap and water whenever you are going outside, or coming to home from outside. That is the most important thing. For 15 to 18 years of kid, as we know, our government of India has started COVID vaccine. Obviously, if there is no particular contraindication advised by your doctor that this kid should not take a COVID vaccine. For example, some kids are on steroid, or some kids has some oncology related complication. Except those, all the normal kids, they within 15 to 18 years, they should take COVID vaccine. There is no alternative of that. Vaccine can only transform our life to normal. So obviously take vaccine. For smaller kid, I would like to tell, consult your pediatrician and take flu vaccine and pneumonia vaccine, pneumococcal vaccine. These two vaccine can see the most, even before COVID also, the most common reason of a kid visiting a doctor's chamber was fever and cough cold. That is caused by flu. So if you take flu vaccine, at least you will protect your kid from flu. So obviously, unnecessary panic first of all will be reduced, that whether this my kids are suffering from COVID or flu and all these things. And also it will decrease the hospital, the requirement of visiting hospital or doctor's chamber. So obviously for smaller kid above 6 months of age, you talk to your pediatrician, give flu vaccine. And another very important is pneumococcal vaccine that protect the children from pneumonia. So obviously it protects from complication. If the cough cold becomes severe, it is infecting the lungs, so your pneumococcal vaccine will protect. So I will like to tell this for smaller kid, this flu vaccine and pneumococcal vaccine you should take. And for bigger kid above 15 years of age, yes, COVID vaccine is important. And also, I would like to tell, see, up to 5 years of age, there is a routine vaccination schedule for each and every kid, right? So, never miss all this vaccine. During first wave and second wave of COVID, we have seen that as the OPDs are closed or doctors are not available, or we were all scared to go outside. So, all the vaccination, normal vaccination, which is no relation with COVID or seasonal flu. For example, the DPT vaccination, BCG vaccination, hepatitis B vaccination. Up to 5 years, all the parents have a schedule for vaccine, right? So all those vaccines got postponed. All it was totally jeopardized. Some were postponed, or some due to lockdown, or doctors were not available, or something because of fear of going to hospital. Or those vaccination schedule, many children they didn't take, or parents were not able to give the proper vaccine. Don't do that. Whatever was, if your child has taken the vaccine, then it is very good. If you have missed those vaccine for your kid, please talk to the pediatrician. There is some schedule called catch-up vaccination. If your child has missed some vaccination, some immunization, we have a different schedule which is called catch-up schedule or catch-up vaccination schedule. So talk to your pediatrician and discuss with him or her, and make your vaccination schedule complete for your kid. Because if this normal immunization, if routine immunization is complete, then it will help to grow the overall immunity for your kid. So it is very important, because in future not only COVID, other viruses are also coming on the way. This is not the last pandemic, so they should have a good immunity. So this normal vaccination, normal routine immunization, if you give your children up to 5 years of age, that helps to grow the overall immunity of your kid. So that is very important. If you have missed anything, go to your pediatrician and take it. And if your children is in between below 5 years of age, don't miss anything, go and take the vaccine. Other thing is that parents normally ask how to boost the immunity of the kid. There is no booster. It is not like there is some immunity boosting medicine, to be very honest. Yes, some medicines or some compositions are now available in market called immunity booster and everything. But to be very honest, there is nothing like that. Good diet, good hydration. Every day try to give fresh fruits, fresh vegetables, whatever seasonal fruit is available, try to give that. And freshly homemade food. Avoid outside junk food, like chips and burgers and chocolates. Yes, every child has a tendency, they like to have all these things. Yeah, if they go to some birthday party or once in a month, obviously they should have some chocolate. It's not like these are not totally banned. No, never like that. But not every day. It's not like every alternative day they're having chips, or every evening they're having some chips, having some burger, or munching on something, or having chocolate. No, this avoid all these things. Good diet, fresh fruits, vegetables, and good hydration. These are immunity boosters. And also exercise. See, nowadays for last 2 years, all the children bound inside the home, and they are not doing any exercise. See, no, my child never sits at one place. He always roams here and there, and that is the exercise. No, this is not correct. Exercise means that should be active exercise. So obviously, outdoor playing, that is the best form of exercise. Running or any outdoor game, for example football, cricket, these are always the best form of exercise. If that is not possible, nowadays many children don't have access to playground and all these things. If those are not possible, at least make your child do jogging or skipping or cycling at the roof, or even at balcony also skipping is possible. So at least for half an hour per day minimum. It's best if they can spend 1 hour, but at least half an hour per day skipping or jogging or cycling or free hand exercise, active free hand exercise, for example sit up, all this thing for 30 minutes is necessary. It's definitely necessary. There is no alternative of exercise. It will improve the secretions of different hormones and different chemicals in our body, which helps to grow the immunity in a positive way. So obviously exercise is important. Okay, so from their childhood, try to input that good habit into them, that they should do exercise for at least half an hour, and active exercise for half an hour. That is the thing. And these are the immunity booster. There is no specific silver bullet for immunity booster. If you follow a healthy habits, if you avoid outside food, this will help for immunity boosting. So I think these are enough. I have discussed the common symptoms which we are seeing nowadays in our day-to-day practice, that and how to tackle all these things. Don't panic. There is no specific medicine for COVID in children. It is not like, my children is COVID positive, so I will give this medicine. No, no medicine is available like that. All is symptomatic medicine, and most of the children are recovering from COVID without any complications and within 3 to 4 days. So don't panic. Keep yourself calm and composed. Give medicine properly. And nowadays many pediatricians are available even for online consultation also, including myself. So talk to your pediatrician, whoever is a nearby pediatrician, either physically or by video consultation or teleconsultation. So just consult with them, keep a contact with them, and your child will be fine. Most in 99% of chances, 99% of cases, they will recover it soon. So I think this is from my side, this is enough. If you have any question, yeah, happy to answer that.
Yes, in case anyone has any queries or any questions, you can leave a message in the chat box. Dr. Bidisha would be happy to answer your questions.
I think it was a very, very well informed and very well, planned session, Dr. Bidisha. You have covered almost everything. So
thank you. Yeah, I am seeing one question in chat, that for cough, what can we take care of? I think I have discussed that in details. Same for cough, home remedies you can try that simple home remedies, for example honey, tulsi, ginger, black pepper, all these things, and some simple cough syrup you can try. You can talk to a pediatrician, give cough syrup, give some lukewarm water. Bigger children can do gargling with hot salted water, lukewarm water added with salt. They can do betadine gargling also. Otherwise, frequently having some lukewarm milk or soup or dal water or simple water, that is enough. And the cough will take a minimum 4 to 5 days to subside. So have your patience. Other one more question is that, ma'am, ear pain, how can we take care of that time? Okay, ear pain, see, the cause of ear pain might be inside the ear infection or some wax, excess wax in the ear, or it might be from cold, because see, nose, throat, ear, all are connected. So if there is some cold or some sore throat here, then that the pain can be referred to ear, and it can cause ear pain. So again, the simple decongestant or antihistaminic syrup which we use for cold, that is more than enough to take control of that ear pain, and you can use paracetamol along with that. In 90% cases, these two are enough: the cold medicine, antihistaminic or decongestant syrup, and the paracetamol. Also try to check the ear with a torch. If you see that some liquid is coming, whether it is a clear liquid or whitish pus like or yellowish, then you should visit a doctor for ear examination. And yes, some wax is normally expected inside the ear. Wax is a physiological thing which is good, so never try to poke the ear with this earbuds and all these things. If too much wax, consult your pediatrician. Use some de-wax ear drop. Some wax will come out on its own, some wax will remain inside. Don't try to clean the air with earbuds. That will cause more infection and more pain. Okay, what is the energy drink we can give? There is no energy drink as such. You can use, yes, some protein eggs, then this Horlicks, Complan, all these things are available in market. These are not magic energy drink. Don't expect that if you give this energy drink to your baby, your baby will be too much energized, or your baby's weight gain will be boosted up. No. But yes, if you happy to give that for your mental satisfaction, you can use all these things. Otherwise, for energy, you should give fresh fruits, fresh vegetables, seasonal fruit, homemade food, good hydration. These are the magic energy food. If not energy drink, energy food. And keeping your child well hydrated. Avoid excess sugar. Don't give excess glucon D, excess fruit juice, and all these cold drinks and thumbs up, all these things. And for bigger kids, sometimes they take tea or coffee, and the parents think, yeah, they are taking some liquids. No, this tea, coffee, caffeinated drinks, and also this thumbs up cold drinks, right, they can cause more dehydration paradoxically. So give, I have told many times, what are the fluids recommended. Give those fluids. These are the energy drink. Okay, Dolo 650 for kid. For age 15 years. See, as I told, Dolo 650 is paracetamol. So the paracetamol dose depends on your baby's weight. Okay, so it's not depends on your age. Yes, for at the age of 15 years, definitely you can use Dolo 650. But how much to give, whether half tablet or 3/4 tablet or one tablet, that depends on your baby's weight. So talk to your pediatrician, he will guide. As such, Dolo 650 plain paracetamol definitely you can use. Okay, a 3 months baby who got congestion in night. Congestion means if nose congestion, as I told, you can use nasal saline drop that are available in Nasoclear nasal drop or Nasovian nasal saline drop. This drop you can use every second hourly in your kid. And if nose block is too severe, then you can use some decongestant syrup also. For example, mucolite, all these things. I'm not sure how much it is right to mention the brands, because I have no no personal preference of any brands. So you talk to your pediatrician. You can use, for as of now, you can use nasal saline drop. Have I missed any question? Then anyone can tell me.
A parent is asking, is frequent rubbing of ear, is it normal for children if they keep rubbing their ears frequently? Is this a sign for taking them to a pediatrician, or is it a normal behavior?
Yes, rubbing ear means there is some, if frequent rubbing, then that means some ear irritability is there. Again, that might be due to cold. That is the most common cause. As I told, that the nose, throat, ear, all are connected. So if cold is there, yeah, some referred pain or referred irritability might be there in ear. So that is the most common cause of ear rubbing. and the treatment is also same, the paracetamol drop and the decongestant drop for cold. But yes, if it is too much and if it is giving trouble to your baby, definitely you should visit your pediatrician for ER examination.
What should you do if your child gets swelling on one eye?
Swelling over?
Eye.
Swelling over eye. Swelling over eye is not common. Some swelling due to cold at during morning time while the child is waking up from the sleep, that is expected, and that will go once the day passes. They becomes little more active. That will go on its own. But if the swelling is like a significant swelling is present over the eye every day morning, then you should visit your doctor for detailed evaluation.
Stomach pain for kids like indigestion or acidity when it is there, what should you do as a parent?
Okay, for stomach pain, there is some syrup, for example, D-colic syrup, for Meftal spas syrup, that you can use. Give more water, liquids, and you can give some outside hot compression, all these things. You can use some probiotics. If you have curd and yogurt at your home, you can give that. Sometimes upper abdominal pain due to acidity just below the chest. In those cases, you should give some pantoprazole or Rantac syrup, like that. And again, the most common cause of acidity is not taking proper fluid. So give frequently fluid and all these things.
Okay, how many times can we do deworming for children?
Deworming.
Yes, deworming for children. How many times should we do it? Probably they mean in a
Deworming
year
should
or...
be done every 6th month, once in every 6 months. So, like that, every 6 months you should do deworming.
Another parent is asking about nose rubbing daily. Is
Okay,
nose rubbing
nose
okay
rubbing
or
is
is...
due to cold. Yeah, that's due to cold. You can use like cetirizine syrup or any antihistaminic syrup. These are due to cold, so or allergy. So I think cetirizine syrup or Montelukast cetirizine combination. These are enough. And also, I am mentioning all these things. Please don't start using all these things on your own. Talk to your pediatrician, know the perfect dosing, and then use it. What is deworming? Deworming means it is not WARM worm, it is a WORM. That is, sometimes there is some worms in the stomach of the kids that causes perianal itching and stomach pain. So that is deworming. Okay, so that deworming you should do every 6 months, whether your child is symptomatic or not. Every 6 months you should give a deworming dose.